Hi, my name is Ashley Davenport and I'm making this video for my pathophysiology class. I'm with my friend Taylor Shockey today. She suffers from fibromyalgia and she's going to talk to us about it.
Hi, my name is Taylor Shockey. I'm 21 years old and I have been diagnosed with fibromyalgia for about 6 years now. However, I have been suffering with symptoms since I was a small child. So really, I would say that overall it's been almost my entire life. So the diagnosis for me getting fibromyalgia was really complex. I really knew something was wrong with me, so I told my mom, and she suffers from fibromyalgia as well. It's very genetic, runs in women and families. So she took me to the doctor, my general family physician, and we told him like all the symptoms that I was having and everything. And at first I was misdiagnosed with polymyalgia. Which it was strange he even diagnosed me with that to begin with, because typically that is in much older patients. So he said that he wasn't definite on the diagnosis. We had some tests ran, different blood work to rule out other potential autoimmune disorders. I was tested for different vitamin levels, and I was deficient in ones that people with fibromyalgia are typically deficient in, such as iron and B12, things like that. So he decided to do the tender point test. There are 18 tender points on a person's body that has fibromyalgia that, when pressed, cause severe pain and discomfort. At least 11 out of these 18 points have to be active, and when he tested mine, all 18 of them were active that day. Typically mine, almost all of them usually are active, and he said that for my age, it was more of a severe case that he had seen and referred me out to a rheumatologist. With fibromyalgia, a big problem that many fibromites have, I wouldn't even say many, all of us have, is flare-ups. So basically, a lot of illnesses have flare-ups, so MS and RA, all of those, you get flare-ups. Basically what happens with me, I notice I start losing loss of motor function. I'll start getting really clumsy. My limbs will give out. So sometimes when I'm walking, they'll just buckle under me and I'll fall. The extreme pain is the most noticeable, and the sensory overload. So bright lights, even just someone simply touching my skin like this can cause pain. When it typically is supposed to be pleasurable, it's painful. Basically that is what happens in a flare-up. Everything is amplified. It's very intense. Typically during flares, I don't sleep at all. The agony is so intense that typically I have to have narcotic pain medication. Sometimes I have to go to the ER to get hooked up to different pain medication drips. It's not really something that I enjoy, but it's necessary because the pain is real, the pain is intense, and there's nothing else that will stop it. There's no cure for it right now at all. There's a lot of developments in the field right now with it, but so far they haven't got anything. So basically when I go with a flare-up, I just have to kind of deal with it, take the general medications that I'm on right now, and if necessary, go to the emergency room. There's severe tingling and numbness in my limbs, my arms, hands, and legs. My feet and hands get extremely cold. I shake a lot, and typically during flare-ups I have tremors, and that means you just shake, you're not having a seizure, but you're just violently shaking. It's uncomfortable, can be painful, it makes your muscles sore and hurt. So overall, when you have a flare-up, basically all of your symptoms that you generally have with fibro are very intensified. And another thing is I will run low-grade fevers, and that's another way that I know, and I literally feel like I have caught the flu, and that's how I know I'm in a flare-up. Typically it lasts a couple days. Usually it's never just one day, it's always a couple days. The symptoms that I experience are chronic widespread pain, fatigue, sleep disturbance, really severe insomnia, cognitive dysfunction, and basically what that is it's not really a dysfunction, it's literally just brain fog. So sometimes I'll be driving and I'll be oh wait, where am I going? And then I remember again. Really bad morning stiffness, cramps and muscle spasms in my legs and arms and back. Restless leg syndrome, especially at night, gets really bad. That's one of the things that keeps me awake.
So does that tie into the insomnia too?
Yeah. And Digestive problems, like a lot of people with fibro have like IBS and some like food allergies. So like I'm lactose intolerant. There's like certain nuts I can't eat, things like that. I get cluster headaches, and my migraines aren't as like intense as a lot of other people like with fibro. I have more of the cluster headaches that are like one spot on your head. And then the like skin sensations, like the allodynia, like where my like hair will hurt, or like my skin. Like so sometimes when I get in the shower, like the water pressure will hurt my skin, like if I'm really sensitive that day. Balance problems, so like off balance, like lost coordination, and then just like general like nervous system like overload, like everything's just really intense, like lights and sounds, like touch, everything like that. Pain especially, obviously, like that's the main problem. So those are the main symptoms. Obviously there's like other stuff like, you know, the low grade fevers, rashes are common with a lot of people, especially on the face, and like, you know, you get like hand pain, like coldness in your hands especially, and feet, like they're usually very cold. And then another really big thing is you're either cold intolerant or heat intolerant. So that means like either the heat makes you feel really good or the cold makes you feel good, and one or the other causes you discomfort. And it's usually like it's never both, like it's always one or the other.
So with that, you're one or the other?
Yeah, so with me, like heat is what makes me feel better. So like I really like going, hot shower, hot environment, like, you know, hot summer, like I love the summer, I thrive in the summer. That's when I have my least amount of pain.
So winter kind of flares it up with
I have way more flare-ups in winter, definitely, I would say, versus summer, because like the coldness, it just like, for me, it like gets into my bones and it hurts, like it makes everything worse, like the pain more intense, like, okay. So yeah, extreme fatigue, you know, you're tired like all the time. Even if I do sleep, like I wake up and I'm tired, but you know, I still like push myself and everything, you know, like I feel like a lot of people like that are older, that high fibro, probably take it easier. Like I try to take it easy, but obviously there's times I push myself, and then obviously I pay for that with a flare up or like, you know, just extreme discomfort. But you know, it's just something you have to learn to live with. So yeah. The medications that I take for like my fibromyalgia and like conditions that occur because of it are the iron pill for the iron deficiency anemia. Most fibromites are iron and B12 deficient. Neurontin, also called gabapentin, it is like a nerve like calming medication, kind of like it makes you not be in as much pain when your nerves are firing, which is a big part of fibromyalgia. Flexeril and cyclobenzaprine, I've been on both, and even been on both at the same time. Those are muscle relaxants, really good for the restless leg syndrome that is caused by the fibro at night, and just for general muscle spasms and pain. Toradol and meloxicam, those are similar. They're like anti-inflammatory types of drugs. I have an inhaler for my asthma, which also, having fibro, it can cause shortness of breath during your flare-ups. And pain medications, every time that I have to go to the ER, they give me morphine and usually send me home with Percocets.
So how often, sorry to interrupt, how often have you gone to the hospital? Like, is it often, or?
Yeah, usually like if you're a chronic pain like patient, like they know like you're gonna come in. Especially if you don't have like a regular like pain medication doctor specifically, because a lot of normal doctors don't like to. So right now I'm referred out to this pain clinic and I'm waiting on an appointment with them. But for now, usually the hospital, they give me the morphine and then the Percocet. They usually send me home with like 20 of them, the like 5 milligrams. And like they, you know, that lasts me like for a little bit and helps with the pain more than like really any of the other ones. And then the other one would be trazodone, helps me sleep for the insomnia. Every person with fibromyalgia typically has really bad insomnia because like you're in a lot of pain and it's just hard to sleep, and you know, it's just makes it impossible sometimes if you don't have something to like help you fall asleep.
Are there any stigmas you're trying to erase surrounding this illness, and why is that important to you?
Yeah, definitely. People specifically with like fibromyalgia, like, you know, some of my family members that don't obviously have it, you know, like they're like, well, why can't you do this or that? Like if I'm like, can you help me like pick this box up or like open this for me or something like that's difficult, like they're like, well, you're young and like, you know, whatever, like you should be able to do it. And it's like, well, I can't. That's why I'm asking for your help, you know, just because I like, you know, am a younger person and like might appear to be healthy or whatever, which, you know, I am. Like, you know, the fibromyalgia is not like killing me, but like I'm also not healthy in that aspect with having it. So I need people to understand that like sometimes I have to like take breaks, or like I can't push myself constantly. And I'm known for pushing myself, but like sometimes it's just too much, and people need to understand that people with fibromyalgia are not lazy. Like, you know, there's times I get so frustrated and I want to go do things or go out with my friends, or like I want to draw or, you know, work on a design or something, and I just can't because it's just too much. Like it hurts, like my hands will hurt or my legs will hurt.
So you've said that people have actually called you lazy even within your family?
Yeah, I mean, before they understood, and now I've had those same people actually apologize to me. You know, once, like I literally would show them my medical papers, and
Educating them.
yeah, and now that more people are understanding that like fibro literally can qualify someone for disability, like I've literally had them be like, I just didn't understand it, like, but you know, like, I'm sorry, like, you know, or they'll like, you know, try to like help now if I ask for help or whatever. But, you know, like my boyfriend is very supportive, and like, you know, my close friends for the most part, I would say, like, you know, they understand. But then there's also like people like they just don't understand, and they like will get frustrated, you know, if I can't go out with them, if I say like I had already promised to go and then I can't. But, you know, it's not my fault that I have this, and I need people to just, you know, have some more compassion and empathy, like, for people, you know, because it's really something that's hard to deal with, and you have to learn to live with it, and you just sometimes feel like nobody understands you. And I feel like more people should be educated on it and know how to help their loved ones that have it, and help be able to, you know, take care of them and stuff if they need that.
I wanted to thank you, Taylor, for making this video and educating my class. We've been friends for a really long time, and I know that you've suffered from this for so many years. So just, you know, thank you for making this, like, helping me do this video.
I'm glad that we, you know, got to like help educate the class and everything on this chronic illness. And
Yeah.
so I hope all of y'all understand how important it is.
Hope you guys enjoyed. Thank you for watching.